Good afternoon, and thank you all for joining us for the Reconnect, Reflect, and Renew Facebook Live conversation series. This is the second session of a three-part series that is being hosted by the National Training and Technical Assistance Center for Child, Youth, and Family Mental Health, NTAC, in observance of Mental Health Awareness Month that is observed during the month of May. As our event's title suggests, this year's theme is Reconnect, Reflect, and Renew. During this and the following discussion, we shall reflect on the challenges and needs of the past year, reconnect with young people and their families, and renew our commitment to building a strong and equity-driven system of care. During today's session, our focus of reconnection, reflection, and renewal will also be geared toward the mental health and wellness needs of early childhood and school-age children over the past year and the transitions they have had to endure. My name is Eve Kucharski, and I am a change specialist at Change Matrix, and I will be moderating today's event. And I am also joined by three wonderful fellow panelists who each bring a unique lens and expertise to children's mental health work. First up, we have Pamela Trivedi, who is an infant and early childhood transformation team lead for NTAC, member of research faculty at Georgetown University Center for Child and Human Development, and a licensed clinical psychologist and nationally certified school psychologist, who has also done significant work on national policy and research about children's mental health. Jeff Bostic also joins us. He is a child psychiatrist specializing in an outpatient clinic, community mental work, working with pediatricians and in schools with a SOC focus. And his community-based work in schools is particularly through telepsych to increase access for those in DC. He also specializes in collaborative relationships with PCPs through DC MAP, and of course, clinical work at Georgetown is increasingly a family-first system where they are seeking to empower parents and still engage youth and their participation in care as we try to better understand individual needs and the cultural factors relevant to their care. And I'm also joined by Adugo Frimpong, who is a licensed professional counselor and supervisor and is the program manager for the Office of Early Childhood Education with DC Public Schools. She also started a private practice in Prince George's, Maryland, as a private practitioner serving many vulnerable children and adults in the DC and Maryland area. Adugo also has many years of experience with the Head Start program in DC. Thank you all three for joining us, as well as the audience today. I would love to start generally and broadly and ask, what drew the three of you to the field of mental health care and specifically child and family-driven work? And Jeff, I'll have you start.
Thank you. And again, it's great to be here. So thank you for including me. Excuse me. For me, it was real simple. I trained in college to be a school teacher, and then I was a school teacher between 7th grade, and then I also taught high school seniors for several years, and then worked for the Lubbock Independent School District and the Waco Independent School Districts down in Texas. So the whole point is, I think like a teacher, like an educator, which means that my focus is mental health more so than mental illness. And so for me, I've always enjoyed working with kids because they're resilient and they're tough and they get better and they do things so that they can thrive and flourish. And it's been great to be a participant in that process.
Adugo, I'd love to hear from you next.
Sure. Oh, thank you for having me. I think what kind of drew me was I started off thinking that I would become a pediatrician. I think that's where I was hoping that to become. But then when I went to college, I fell in love with the psychology. I think I took a criminal psychology course. And from there, just kind of my interest just kind of blossomed. And then having been able to travel when I got my master's, I traveled from DC and lived in Chicago for a couple of years and then lived in California for a couple of years. And in those locations that I lived, I was able to work with a lot of youth and families. And a lot of my work was working with children and families who are part of the juvenile system. So got a chance to work with adolescent sex offender boys and families who were being separated or court involved. So that's pretty much what kind of really drives my interest into that. And then part of it too was, just being an immigrant, who migrated from Nigeria and came to the US, I had my own mental health struggles, just kind of trying to assimilate to the American culture. So that's pretty much what kind of kept me in the field of mental health. And from there, just kind of saw myself working with a lot of families, working with adolescents, and then now working with DC public schools.
And Pamela, I'd love to hear from you too.
Sure. So I didn't know that I had this in common with Jeff. Similar to Jeff, I was studying to be a teacher. My undergraduate degrees are in education and psychology. And in the course of my student teaching, I kind of fell in love with the students who had special needs, the students who were kind of had challenges in learning and behavioral health challenges. So I kind of transitioned and studied school psychology because that was, very close to kind of special education training that I had some coursework in. And I really liked doing the school-based work and school-based populations. At some point, it seemed that it just seemed like by the time a kid comes to school and has has already been diagnosed and is on their way to a self-contained classroom for behavior, there are points to intervene earlier. So I did some specialized work in infant and early childhood mental health to try to intervene earlier with children and especially families and caregivers. But I still love the school age populations as well.
Thank you all for those introductions. I think it'll help contextualize what we're talking about and your experience as we continue forward. And briefly, just before we begin, I'd really like to encourage, if anybody in the audience, both on Facebook Live and on Zoom, has questions, please feel free to share them within the chat. Our panelists will also be sharing some links to resources and data that might be helpful for you to reference later. So please feel free to share your thoughts. So I thought I'd start with a nod to COVID-19 specifically. As we're talking about reconnection during this time, it's incredibly important to focus on the tremendous mental health impacts that are happening regarding that pandemic. And so what are some of the special considerations for working on mental health issues with infants, toddlers, and young children and their families within this crisis? And Adugo, I'd love your thoughts.
Sure. I think the biggest consideration is just to think of kids who, coming into this as a blanket canvas, right? So they're learning, they're soaking up a lot of information. They're watching us as adults respond to stresses and things like that. So one of the couple of things that I tell providers, especially in regards to working with children, is to be sensitive to their cognitive and social emotional development. Right? Like be familiar with the development theory and exposure in regards to child development. Our kids at a very young age don't have the vocabulary or the words to kind of express their feelings and their thoughts. So, kind of be sensitive to using things that they're most familiar with, like toys, dolls, books are usually great objects to help kids kind of find the right way to kind of express themselves. So those are the things that I would say to be really our special consideration for our young ones.
Pamela, I see you nodding.
I think those are great considerations, Adugo. Thanks for bringing all of those up, and especially the fact that some of the young children that we work with are not verbal yet. So I think one thing that's striking to me in thinking about the difference between working with school age children and working with infants, toddlers, and young children is the opportunity to build the capacity of adults working with them to handle difficulties in development and difficulties with behavior and just overall to support development. A lot of the work with these younger populations is on the consultation side. We are consulting with early childhood teachers, childcare providers, and kind of family members who care for these kids to kind of support their work with their children more so than working directly with children in a lot of cases. I mean, I think some of the approaches that Adugo cited are absolutely right. Some of the play therapy approaches and some of the other work that are sort of great techniques for working with young kids. I often found myself working with families and teachers more than actually the young children.
Certainly. Oh, yeah, please go ahead.
No, and I was just going to add on to what Pamela said. Another consideration is just that family unit. What does the family have access to? Are they able to get the mental health resources or get whatever resources they we're recommending or referring them to partake or engage in, right? And another thing to kind of consider is the diversity of the family, right? And how they understand stress and their support system is, I often think of when you're working with a child, you're not just working with them individually, you're working with their whole unit. So you also have to equip the unit to be able to provide the support to the children.
And you've talked about the special considerations, but what are some of the direct impacts that you've seen on the mental health of young and school-age children in your work? Jeff, I'd like to start with you.
Yeah, we know that anytime you have some kind of, frankly, very difficult circumstance like a pandemic, things don't go well. That rarely is something where it's like, well, this has really been fortuitous in a plethora of ways. So concretely, there's a really good research study that just came out a couple of weeks ago, April the 29th, by Ravi et al. And again, not trying to be too overly scientific about it, but the point is the distillation was they looked at literally over 30,000 caregivers in the Chicago area actually responded to this survey. And they said, man, it's been tough. It has been, we've seen suicidal ideation go up like 50% in the kids that, again, the parents who are reporting. They were saying that there's been a 10-fold increase in kids complaining of loneliness. That coincides with other research that we've had over the past year that says the same thing. Teenagers are like, this is particularly are like, man, we feel isolated, as do younger children as well. So we know it's taken a big hit on not just the students and the kids, but also the parents. Only 1/4 of the parents said, yeah, it's gone about as good as I could hope for it to be. But I want to clarify, going as good as they would hope for it to be during the pandemic does not mean it's been going well. And 3/4 have been clear to say it's been bad or worse than we would have anticipated it to be. It stressed us out. We've tried to be teachers as well as simultaneously be parents. And we don't know if we should have our kids playing with other kids or we should form pods or where we should go to do anything. So it's been really tough on them. And dadgummit, it's been also equally hard on teachers. There was a really nice study that came out of New Orleans way back last May. They were like, I'm not sure what I'm supposed to be doing here. I never trained in teacher college, if you will, to work virtually exclusively. And so it's we're not really equipped to do all this kind of stuff. And so if you look at stuff now from the Department of Education, 1/3 of teachers are like, I'm thinking about leaving the profession. This is just not working for me. I'm gonna have to do something else. 25% are like, I'm really unhappy with my job situation right now. So it's taken a toll on everybody. It's taken a big hit, or it's been a big hit for kids, for families, and for teachers or educators, have had to work in this kind of system.
I wonder also, as big of a hit as teachers have taken, it seems that has extended out to providers as well, in terms of their own capacity to deal with what seems like a greater inundation of requests for people seeking mental health services really at all stages. And of course, this includes early childhood as well. I was really curious, what are some factors and considerations you might advise providers to be mindful of? How do you keep that capacity, as you said, regarding the teachers earlier, thinking of leaving their profession? How do you maintain a positive attitude and continue on with this work, which is hard? It's very difficult. And anyone who'd like to jump in.
I was going to say, I often pull on resources from having been in Head Start for such a long time. I often rely on some of the resources that Head Start puts out, as well as the Administration of Children and Families, right? So a lot of the work that I often advocate with teachers and advising principals and school leaders of what to do in regards to that preparation of bringing teachers back into the classroom, or in my private practice, teachers coming in because they themselves are experiencing some feelings around anxiety or that anticipation of going back into the classroom. A lot of times I often find myself sharing resources around prioritizing staff wellness, right? Like inquiring what your staff are worried about or their concerns or what they're anticipating about coming into the building or just re-engaging with youth. Another thing I often tell them about is training. This is like the great time to kind of, while you're listening and hearing their requests, you front load them with a lot of training, right? Resources around trauma, resources around stress management, information around how to deal with children who have experienced grief and loss. It's often a good time to bring those resources to them and make them at the forefront for providers and staff as well as parents to kind of utilize those resources to the best of their knowledge and help them to make it fit the current situation or what they're experiencing. Because everybody's experienced stress and grief and things different. No one experiencing the same.
I think that's so helpful, Adugo, to hear your perspective, because I know you support a lot of providers and teachers of kids of a range of ages. I think that's right. I think that that's one thing. A lot of times we're focused on the struggle of families and kind of parenting stress during this time. Teachers are, I think this is just an amazing opportunity for one silver lining here is that we've all experienced some of the same stressors. Often as providers and people who think about policy, we haven't experienced the same kind of stress as some of the families that our programs and policies are directed toward. This is one moment in time where there's been some collective experience of trauma and stress. So kind of to the opportunity to think about the position of teachers or providers in a way that perhaps is more empathetic than we've had before. A lot of the teachers have experienced economic hardship and loss themselves. A lot of them are from communities, especially in kind of this DC, Baltimore area. A lot of and lots of other parts of the country as well, I know. A lot of them are from, in Head Start, there's a lot of teachers and assistant teachers that are from the communities of the children that we serve in these federal programs as well. So they've experienced a lot of economic strain. They've experienced, they're still of the generation where there are kind of living in multi-generational settings where grandparents and other older family members feel a lot of hesitancy and anxiety about the vaccine, and anything that we can do to sort of acknowledge the fears and anxieties are real, acknowledge that, and provide sort of culturally appropriate public health information to families and provide and kind of teachers as well. I feel like that's one of the main things we could do now and come from a strong place of empathy, given what we've all experienced in the past year, understanding that certain communities were really hard hit during this time.
I'll just jump in here. I think I'm on. I'm not muted now, right?
No, we can hear you. Yes.
Beautiful. We've tried to be real concrete about this. Actually, a couple of years before the pandemic hit, we had recognized that teachers in the DC area still suffered a lot of burnout, a lot of stress, and that we had a lot of teachers who were leaving the profession. So we started doing teacher well-being stuff then. So that's only, of course, intensified during the pandemic. But the point is that we have, for example, one free resource for teacher well-being, and our little mnemonic is POISE, which is POISE, right? Like the word, but it's like for physical well-being, occupational well-being, intellectual well-being, social well-being, and emotional well-being. And so people can kind of go to whichever part of that they want to do and do it. We have a workbook that's I'll put on the website now, or I'm sorry, in the chat box. It's free. It's not going to change, and it's devised for teachers. But the question a while ago was, wait a minute, what about clinicians? And we're definitely very concerned about making sure that we're working on compassion fatigue that they're suffering, trying to do so much for so many people, and resilience. And so the point is that the University of Maryland is literally right now taking this workbook that we've used for teachers and extrapolating that to be for clinicians. And that should be out in a matter of months also. So there are some real concrete things to do. And of course, people don't have all this stuff at one time. It's like, my sleep's fine right now. And then 3 months later, it's like, but I'm in a freaking toxic environment. I don't know how to deal with all the crazy things I'm dealing with. So they need different things at different times. So we wanted to kind of package things together so that people would have access to stuff depending on what's kind of like ebbing and flowing through their life at one time. I did want to comment on the other thing, though, that Pamela just alluded to, which is so important, which has been what's going on now with vaccination kind of stuff. And we've kind of thankfully made the corner that most people across the United States want to get the vaccine now. Adults, it has switched. It switched in about February or so, and it's all groups, like all different kind of groups. And some are more supportive of it than others. About 20% of adult Americans are like, I'm not taking the vaccine. You can say what you want, it ain't going to change my opinion. But about 60% of adult Americans now are saying, yep, I would like to get this when it's available. That is, they've moved from a larger group that was in the wait and see category to a larger group of, it makes sense to me, I'm good to do it. That's the good news. The not quite so good news is the adults who have children who are currently in school are like, nah, even though it's down to like 12-year-olds now who can receive the vaccine, I think I'm going to wait and see. So it's about 50-50. About 50% of parents are like, yeah, I'm receptive to them getting the vaccine, particularly if the school is going to encourage or require that for them to be back. About 38% technically are like, I'm going to do it as soon as it's possible. But the other 50% are still in that, I think I'm going to wait and see, or I'm not doing it. So again, we still have ways to go or miles to go before we sleep.
Sure, I appreciate you jumping in there. And I wanted to also highlight something that Tracy in our Facebook Live chat mentioned. She just echoed that this may be one of the first times that providers have experienced the same sort of stress as the families they serve, which I was curious if the panel wanted to touch upon that before we move on.
Yeah, it is. Oftentimes just in my private practice, I sometimes feel the anxiety, just having to be home and working from home as well as raising my own 2 kids, right? So when I hear staff or providers talk about their own mental health, their struggles or feeling fatigue to be in front of a computer for such a long time, sometimes we often forget that we're sacrificing ourselves for our clients, but neglecting our own mental health. And sometimes we also have to take a step back and focus on our own self-care and acknowledge how we're feeling at the moment to be able to address it in order to be able to provide the support that we want to be able to provide to families who will need it. Yeah.
I totally agree. As a clinician myself, we see patients every week. Both we see the adversities that they struggle through, they're so hard, and we also resonate with those. I mean, we've all been in a relative way socially isolated, and that's taken a toll. We're used to like engaging with other people, and we haven't been able to do that. That's hard as far as like a support mechanism for us that's been gone. Many other, I'm sorry, but economic adversities, we've all struggled with our ways to navigate that. The other goofy thing for me has been the dadgum clinical part of it. Again, I was trained some number of years ago to do clinical work with people in a room where you would look at them and you could see everything that was kind of going on, and you could get a sense of how they attach to their mom or their dad or not. It's way harder when you're doing this stuff virtually. You can see a screen. You don't know what else is going on around them. You don't know who else is in the house doing what. You can't always see their arms and legs and what they're doing. So it's really been hard as far as teachers, clinicians also feeling like, I don't really have the expertise that I wish that I had to be able to navigate this stuff so easily. So it's been a rough go.
And as far as did I cut you off there?
Oh, I was just going to add on just the use of technology,
Right.
Right. Having to navigate I thought, the basic technology skills of how to turn the laptop and do certain things would be good, but now you're having to be more advanced or intermediate when you're using technology. So you can only imagine for our families and children who are engaged in distant learners or having to rely on grandparents to help them to get on there. So not only did we learn that the mental health piece, but we're also learning there's a skill set that we also have to kind of support our families to navigate in this new way of engaging.
we've talked a lot about the difficulties. I'm curious too, are there strengths that you've learned and seen clients and communities that you've served, and have you learned from that in your role? Pamela, I'd love if you could start with that one.
I mean, I've been super impressed by kind of speaking to some of the things that Adugo and Jeff just mentioned. I've been super impressed by the ways that providers and teachers have been able to build rapport, especially with young children in this virtual environment. I also have 2 young children, and I could just say from this side of the computer, my daughter was in virtual kindergarten this year. But somehow teachers were able to engage with her. She had never met these teachers before. She just met them last week. There was a school sponsored play date where she was able to meet her kindergarten teachers in person for the first time. But just so many ways to navigate technology in a way that's engaging to kids. There's also kind of tremendous issues of access to kind of all kids being able to, I mean, not all kids have broadband, not all kids, many schools across the country have provided children with computers. Sometimes the internet connections are poor. But even with all those challenges, with limited tools, just the way that providers have been able to engage with kids, there are really interesting technologies that have developed, or apps or tools such as a virtual sandbox for therapists to use with young kids. It's some approximation of being able to work with a young child on sensory tools and with a sand tray, and it's on a screen. But it's just been impressive how flexible providers have been. I'm always super impressed by the resilience of families, especially when we know that many more families are experiencing hardship, financial hardship. Many families have been had to make especially of young children, have had to make very difficult choices between kind of having to work in person and continuing to supervise or help young children with virtual school. Some of us have the flexibility of being able to work virtually. Not every family has that. So as Adugo said, families are relying on friends, neighbors, grandparents to help with childcare and the administration of virtual school during this time. So I'm really impressed at the way communities have come together, and also by the ingenuity of providers and I mean, you can just see from my end as a parent, you can see how great these teachers are when they're able to connect with 3-year-olds and 4-year-olds and kindergartners that they've never met before virtually, and build that relationship. I mean, in early childhood, the emphasis is on relationships more than it is on the pre-academic skills. So kind of being able to build this in this flexible way when they themselves are under a lot of stress as well has been really impressive to me.
Yeah, I was going to add to that, Pamela. You brought up a good point. I think just the idea of resiliency, creativity. I've been able to see teachers like turn their rooms or their house into like virtual classrooms, and use some of the materials that you would see at school at home and have the kids really engage. Especially when you're looking at my population of 3 to 5 years, it's difficult to keep their attention focused, right? And then you add those who have special education needs, right? But one of the things that I just enjoy watching the teachers be really creative about how they create their space, how they bring in the kids into this virtual classroom when they're doing that. Another thing that I've also noticed is just parents working with each other and advocating and sharing of resources. It's great that, my office has things, but it's even, it means a lot when a parent has something that they're willing to give and they go that extra mile to just deliver it, right? So just kind of seeing a community work together and support each other. And I think that's what I really enjoyed, that watching and hearing those stories as strengths for families during this time.
Certainly. And I wanted to touch upon a subject also that I think is really prevalent in generally the field of mental health. And that's really the stigma about receiving mental health and what that can mean. But I'm curious from your perspective, do you find that it's more prevalent around children's mental health especially the younger that children are? And if so, if you do find that to be the case, how do we break the idea that childhood mental health, break the idea that childhood mental health isn't as important as maybe in later stages of life?
I think one good opportunity we have working with young children is, again, sort of what drew me to the field of early childhood, is talking about a prevention framework. So a lot of times I frame things as supporting social emotional development. And it's easier for us to do because a lot of the kids we work with, it's before they receive a behavioral health diagnosis or a diagnosis that they have special learning needs. So I feel like, compared to working with school age kids, it's a little easier to engage families. And I think stigma is a little bit less because it's framed in terms of support and being proactive, rather than from a deficit perspective, which we see later after we get into the clinical diagnosis, the age at which it's appropriate to assign a clinical diagnosis.
Well, I got a couple of thoughts on this particular topic because I think it's real important. The biggest one is that I think it's kind of like fundamental that when you go to the grocery store and your child acts erratically, that you certainly feel very uncomfortable. And other parents, I think, look around and you're like, my gosh, what's going on at home that this kid is acting out like that? And so the point is that I think the stigma is really tough in young kids because, not malevolently, but it just plays out this way. I think all of us as parents want to believe that there's a reason if this kid's acting up or doing something that's weird that the parents are doing, because I certainly hope that I can be inoculated from ever having like difficult kind of circumstances that go on, with my child, because I won't do whatever I imagine that these other parents are doing. So I think that's kind of like one of the hard things that parents just tend to kind of do. So I think it's particularly hard for parents with young children as far as feeling the stigmatization of mental health and mental illness there. Here's the good news. In my career of 30 years, I have watched a lot of stigma actually diminish. And it's been a funny, poignant, not funny, ha-ha kind of thing, where it's been a lot because of athletes and celebrities. We're seeing lots of people in the mainstream talk about this. And specifically, we wrote a paper about this like around 2000. And we looked at celebrities at that time who had come out and talked about their travails with anxiety or bipolar disorder or whatever. And we were able to list about 60. These were people who were out about it. We were not like talking about patients of ours. We were talking about people that were like wanting to be out there and talk about it. They wanted us to revise this paper and update it about 10 years later. And the number had gone from 65 to over 300. And so we see now that a lot of like sports people, a lot of like, celebrity people in all kinds of media talk about this a lot more. So it's made mental health talkable, aboutable within families. So we've seen a lot less fear about this than at least I observed directly 10 even years ago, or certainly 15 or 20 years ago. So I think it's getting better slowly and surely. And here's the thing I like the best. I look at people like Serena Williams. Now, Serena Williams is not somebody that I'm talking about having a mental illness or a mental health issue, but she does well-being mental health practices, like she listens to certain kind of music before she walks out on the court to play tennis. We've known since 1912 that music enhances people's lives and it enhances their performance when they play. In 1912, cyclists in New York City were like running like a bicycling race. And when they went by the areas where the marching bands were playing and they could hear them, they pedaled faster longer, right? So the whole point is that we're seeing lots of people talk about doing things, whether it's nutritional stuff, whether it is, again, like integrating music into their life, emotional ways that they deal with stuff, how they like ready up for like how they're going to do things well. It's like it's really been, I think, very positive to see how people have employed mental health practices right now to diminish the vulnerability that people would have to mental illnesses, but also to contend with mental health stuff. This whole thing of I'm going to get a diagnosis, it's like, I'm sorry, in mental health, there is nothing that we can do in the year 2021 to give you an MRI or to give you any kind of test that will prove you have this diagnosis or that diagnosis. All of us We're kind of like somewhere on the spectrum of how we do with our attention, how we do with regulating our mood and stuff. So I think people have become much more adept at recognizing this is not like you have something so much or you don't have anything at all. It's more like all of us like have periods of time where we have to like work harder on our mental health, same as we do at times with our physical health. So I've seen a lot of the stigma stuff diminish as we've widened our lens about how we think about all this.
Yeah, and I was going to add on to that, even with is diminishing as people continue to talk about it and celebrities are talking about it. I noticed one thing that I noticed in my private practice is that parents or adults that have children are now considering or extending the mental health services to their children, right? Even though they came in for the services for themselves, they're now asking those questions of, hey, do you know a provider that provides play therapy? I would like for my child to be involved. So they're now starting to understand the importance of it. And what I've noticed is, instead of me referring or suggesting, they're asking for it, which is great, wasn't how it was before when I got into the practice. Yeah. So it's a beautiful thing to see that.
Adugo, would you say then that you've seen just a greater understanding of the importance of mental health and wellness and those services as a provider?
Yes, as we continue to have awareness, like this mental health awareness month, and people are talking about it, you have celebrities who are coming out and speaking about their own struggles. It almost makes it feel it's real. I'm not in my own world dealing with something that is invisible to everybody. So what I've noticed is, sometimes when I ask a client what brought you into therapy, they might reference Serena, or they might reference a basketball player that they heard talk about it, and they felt like, hey, if they can do it, I can do the same thing. And and then it just extends to the family unit, which I think is, again, is great.
Pamela, I was wondering, do you have any, do you feel that you've seen that kind of greater awareness? And I was also curious, maybe do you think that COVID-19 in some cases has maybe contributed to that because people are now forced to sort of reflect a little bit more on their own mental health state?
I think that there's been a sort of a wider acceptance of the concept of trauma, and maybe some of it is because of us all experiencing loss in some way during the pandemic, no matter how well resourced we are. So I think I think we've really moved the needle on understanding that there's trauma and there are very traumatic situations that kids of all ages and adults experience, that some as what we know about toxic stress is that there's some stress that's good, and then there's traumatic stress that is not good and has a biological component that Jeff could tell us all about. So I think that there's been a wider acceptance of that concept and an openness to being able to address it that seems to be more widespread now than even before the pandemic. So I think that's right, Eve, of you noting that. Is there more awareness right now? And it relates to some of the things that we've already been talking about, such as the common experiences, that are happening globally, unfortunately.
Right. And I wanted to touch upon this subject as well. In some communities, there is a history of distrust surrounding the term mental health and just healthcare in general. And I was curious if you could go into why that is in some cases, and also how does it translate into early childhood care? Is it different than maybe across other providing spectrums, for instance? I'll pass that along to anybody who would like to jump in.
I would say it's still somewhat challenging, especially when you're looking at population of minorities who have had some negative experience with mental health, right? Or negative experience with providers, or trying to get mental health services, or maybe the outcomes they anticipated isn't what they was hoping for, or just hearing the stigma that comes with that when they're filling out applications or trying to access certain resources. So, sometimes it's just what I found to be is just having to help them kind of rethink their experience, especially when they're early with children. Sometimes I often have to tell parents, I understand that you may have had a negative experience when you were going through your own mental health. How about you help me to help your child so your child doesn't experience a negative experience with that, or teaching them how to be better advocates for their children, right? So they don't feel that what happened to them is going to happen to their child.
Yeah, I'll jump in and add
Sure.
two things. I, of course, totally agree. I most wish that we will be open and inquisitive about people when we meet with them and understand, like, what is it like in your background? How do you make sense of things? You know what? It may not be vogue, and I apologize, but people don't talk about religion or spiritual practices. Well, you know what? I find that they have a big impact on how various people will understand mental illness or mental health. And so it's just important to understand those things and work with people and frankly learn from people that we work with. It's real important. That's the upside. I think we're trying better to not just go in and propose something, but rather to understand something and make and learn from what other people have to tell us about things. There's a long history, unfortunately, of some things that have been done that are not healthy. They were not appropriate, or people were truly, it's not like made up stuff. People were treated inappropriately. It's just all there is to it. I would wish that we'll move beyond that, obviously, but it's hard. And I'll tell you how hard it is. A week and a half ago, it was my turn to do on call in the hospital. So you have to go into the hospital and you see all the patients on the inpatient unit, which usually means the people who are coming here are pretty sick. So we have a young Black male who comes into the hospital, and he's all right. He's not making any sense. He's delusional. He thinks he's going to win superhuman kind of things and do superhuman kind of stuff. And he's talking real fast, blah, blah, blah. And it's like, well, and the family history is significant for schizophrenia in a paternal relative. And I'm like, I gotcha. And we know that Black people were more frequently diagnosed with schizophrenia, while white people were more frequently diagnosed with, for example, bipolar disorder. And I'm looking at this young man who's very intelligent and who to me appears to be manic. And it's like, but he has a history of something that could well have been misdiagnosed or part of that ongoing residue of someone being diagnosed as a group back at a time where people did that differentially. So we were trying to ardently really tease this apart to make sure that we could start distinguishing that. Did he have real episodes where he would become manic and then psychotic versus like a persisting, kind of change or deterioration? But I'm simply saying that some of this stuff continues to haunt us. And I wish for us to be aware of it. And it's sometimes not obvious, but I'm believing that we're trying to be aware of some of these things so that we can correct them and do better here for the future.
That's a really harrowing example, Jeff. Thank you for kind of describing that situation and also what your thinking was as a provider in that situation and your colleagues. That was really helpful. When Adugo was talking, when Dugo was talking about sort of working with parents on their own mental health needs and kind of the impact that has on being a family member and in parenting, that really, it really sort of reminded me of some things that are at the crux of our work in early childhood, so kind of working on those relationships. I think that, when I worked a lot in a Head Start setting with parents and parenting teens who themselves kind of were kind of people of color involved in multiple systems, criminal justice, sort of juvenile justice, because some of them were very young, maybe had been involved in the child welfare system too. So they already sort of have, they already have had experiences working in multiple systems. But I mean, some of the work was really it made me feel so hopeful, because even these sort of young moms who are parenting teens, in spite of all the challenges they encountered, many of them were also experiencing homelessness in the particular center that I worked in. they still really wanted to be good parents, and that was often what was motivating them to get their own mental health needs met so that they could rise to the occasion of being a good parent. So, I mean, I just think that, you know, that is the approach that we take in early childhood, and sort of, you know, the link between parents' well-being and family members' well-being, and, you know, the health and trajectory of the child is really motivating from a sort of treatment perspective when working with parents, you know, who have really legitimate distrust based on their own experience in systems.
Mhm.
We've gotten some action in the chat that I'd like to bring about also. Johanna has asked, I'm particularly interested in defining mental wellness as much as defining mental health. Framing in a wellness context from the beginning can be so beautiful and emboldening. Would anyone like to expand on that? And maybe explain the difference?
I mean, I love that, Johanna. I know Johanna is an amazing, has done some amazing work with youth. So I love that question, and I love that she's sort of thinking it from a whole trajectory of starting early. That's awesome. I think that's right. I think a lot of in mental health care and treatment, we struggle with in terms of addressing stigma. We struggle a lot with our own language and terminology. What if we could describe things as wellness from a family systems perspective, and not the stigmatizing language around mental health disorders or behavioral health disorders? So, I mean, I love that idea. I don't have I wish I had really good definitions for that. I love the idea of reframing and thinking about child and family wellness instead of behavioral health disorders or serious emotional disturbances. I mean, you know, we really need to, as a field, listen to people with lived experience who have been labeled in these really detrimental ways, and think about how we could, you know, just imagine the way we talk about things differently. And I think that will really have an impact on treatment and behavior as well. Jeff was nodding, so I know he has some much more articulate thoughts here.
Well, no, I'm not any more articulated, but I could just say, yes, I agree. I guess there's a couple of funny things. You know, we've really been talking in the last couple of weeks even about, like you alluded to, the language, like for kids to receive services at school, right? So there's like, quote, special education language going back to the Individual with Disabilities Education Act. And it's like serious emotional disorder or serious emotional disability. But a number of states have started moving away from that. Because again, the most important thing for me personally is people do not fit in boxes. They are not this diagnosis or that diagnosis. They may have symptoms of this and that may persist, but they often, particularly when they're young, are on more of a continuum and they move in and out of places. So I think we're trying to make movement out of that kind of way of like looking at things. So hopefully that will give us a chance to kind of widen our lens to this. Now, the direct question from Joanna was wellness versus well-being. Unfortunately, it is really more of probably historical interest than it is of anything else real. And by that, I mean, we were looking at this a couple of years ago only because we were like, are we supposed to be talking about wellness, or is that with teachers, or should it be well-being, or what? And so we literally looked it up, and wellness was used by the World Health Organization, the WHO, to refer specifically to physical well-being. So we're like, we got it. So if we're going to talk about more than physical wellness, then we will talk about these other domains of well-being, like social and emotional and stuff that we've mentioned. So I think most of us have probably used that language more like de facto, not because it was actually like some magical correct kind of term, but it just kind of evolved that way so that we could make distinctions between honing in on physical well-being and can we like get everybody to make sure that they've had their shots when they get to school, that they're getting appropriate nutrition, that they're getting appropriate exercise. That's physical stuff. But what about social emotional learning? Are we making sure that we're attuning to all that from the get-go with kids? And the same thing again with like, wait a minute, are we doing things to help people like to learn with time management, to like learn how to use their attention, to develop their memory, all these other kind of facets of things that are so important to be able to thrive and function well in real life.
I was nodding my head because I have work with Head Start, right? When we think of mental health wellness, right? We think of it from a holistic perspective, right? Are you providing the child, who is the center of everybody's engagement or every environment, is that child's health and nutrition, dental, vision, family unit, are all of those different space that this child interacts with, are they getting all of that things for them to be able to attend well when they're coming to school, be able to feel that they can build connections with their peers and with their classroom teacher. So when we think of, mental health wellness, I'm looking at it from a practical piece as everything, the whole system, how does everybody contributes to this individual? And how is this individual going to thrive in the system that they having to engage with? Yeah.
Yeah, I totally agree. And I want to take advantage of that to kudo out somebody else, which is the kind of holistic, broader look at this is so vital and so important. And so specifically our clinic, where we see kids now at Georgetown, and this is not unique to Georgetown, University of Vermont was the ones who were at the helm of this. And it was Jim Hudziak, who was really this family first kind of guy. The whole thing is that, like, when a family comes in and they're like, I wonder if my child has some kind of like mental health circumstance here that's impeding their functioning with friends at school and in the family, it's like, it's really harrowing from them. But more importantly, none of us went to school, high school, college, or whatever, with rare exceptions. And someone says, and by the way, if your kid does this when they're 2 or 3 or 4, this is what you're going to want to do. Nobody is like prepared for that kind of stuff. So your first thoughts are, oh my gosh, as a parent, what did I do wrong? What did I not do well that has led to this? And so it's like, first thing is like, what can we do to, if you will, enrich the soil or optimize the soil at home so that the parents, who are not necessarily doing anything wrong, but are like, for this kid, this is what kind of environment will help them flourish. So thinking about the parents and stuff first, before we start thinking about diagnostic labeling of the child and what kind of diagnosis and what kind of like treatment we're going to give them, has really been a kind of shift. And I'll just mention again with Jim Hudziak's stuff, since Vermont did all this, they're also the ones who've done this at the other end of the spectrum. They're the ones that did the stuff at the college dorms that's been unlike a lot of public media stuff now, where they said, we're going to have wellness dorms for college. And I'm telling you this because it was a funny story to watch it play out. It was like, no one's going to do this, Jim. He literally got a bunch of violins shipped over from other countries so that kids could play the violin. They had to do that so many like hours every week in their dorm when they signed on to do this. There were all these things they had to do in their nutrition, the whole shebang. They're like, no one's going to do this when they go to college. No 18-year-old's going to go and do this. Instead of one dorm doing it, it ended up that the request for it was 3 dorms worth of kids. So that's what they've had to convert to. And now 37 other colleges basically have been trying to implement some variation of that. So this wellness starts at the beginning, but it persists up until people are at least 25, which is when we think the brain is really more like developed than at 18, which was a arbitrary and capricious time that insurance adjusters figured out many years ago was inaccurate. It's like the brain is still like changing until you're 25. So anyway, this whole piece of like thinking about this from this wellness perspective is really dense and really important across this particularly young age span for everybody.
That ties in nicely too to a question that I wanted to ask, where, what are ways that providers can use their own community resources to connect to youth on a holistic side of things rather than purely clinical? Because as we've discussed earlier, there's a lot of things that clinical care absolutely can provide, but that holistic health approach certainly has value. I see, Adugo, you smiled, so you're on the hook, I guess.
Sure. I was going to say, one of the things that I kind of do myself is just getting involved, just getting engaged in the community. Sometimes it feels good to just see, sometimes I have clients that will come to me and say, oh, it's good to see you in this different light, right? And be engaged and be involved. If it's me going into, like, if I'm in the school, just going into the classroom and being a part of the class and sitting in the on the floor with the kids or playing with the dolls with them. Sometimes it's just, showing that part of them that isn't clinical. And then, sometimes just being genuine, just sometimes, when you see them, you acknowledge, you have small talk, have conversation, how are you doing? So I think just being that authentic of yourself and not the clinical piece also is helpful. Yeah.
Totally agree. And I think both being immersed, we work inside schools, right? We spend most of our time not in hospitals anymore. And you learn so much when you're in vivo with what's going on. But my other thing is I ask a lot of questions because I am at best an inspired idiot. And kids tell me all the time about new good music to listen to. And they tell me about Black Mirror episodes I should watch, like on Netflix or Hulu or whatever it might be of this month. And it's so funny, the stuff you learn. Like there was a girl a couple of years ago, and she was struggling at a certain time of her day because that's when she get depressed. And I was like, well, what cheers you up? And she's like, teacup pigs. I had no clue what a teacup pig was, but the point was she then like pulled up 10 pictures of these things, and we could not look at these things without just like smiling and chuckling. And so she like integrated that into like what her routine was when she would transition from school to home to kind of make her less vulnerable to like, that being kind of like a sad kind of like transition. Instead, it was like a kind of chuckle, funny kind of thing. Well, the whole point is like, and that has only worked for about 50 other kids that I've seen since then. It's like, have you seen Teacup Pigs? And they're all like, I don't know what that is. So it's like, there's all the time stuff that various kids, the youth-driven piece of this, or that families bring about things that they've watched or that have been helpful bonding experiences that I think help really amplify the resources, not just immediately in the community, but in a much bigger, broader virtual community, particularly during the pandemic.
Pamela, also, I'd love your thoughts too on being that our theme is renewal as well. From your perspective as a provider, what does that mean to you, renewal in this landscape?
I think that's a great question for these times. They're right in the past couple of days, there's been really good news about things reopening and unmasking. I mean, it's kind of jarring and surprising to see people not on a computer screen without a mask, but outside in the street without a mask. So I think renewal, from a mental health perspective and from a building resilience perspective does mean reconnecting with the community. I mean, Jeff and Adugo were just talking about being able to go in a classroom. I mean, that's so very different as a provider, kind of trying to connect with a kid. Even though I spoke to how creative providers and teachers are, that's so different from being with kids in a classroom and watching things unfold. I mean, and even doing clinical work, when you're working individually with a child outside of the classroom, it's just so different than, working with a child in a more naturalistic setting and watching the interactions with peers. I love what Jeff, I don't know about teacup pigs. I have to look up that one, but just watching how kids play and kind of with each other. That was one of the things I loved about being a school psychologist, just being able to watch kids and observe, in addition to, the evaluation is one thing and the work that you do with a child, away from their peers is one thing, but watching how things unfold. And providers and teachers haven't had the chance to do that in a long time. So just, walking down the street and seeing kids playing on a school playground and reconnecting with each other, it's amazing, after the year and some months that we've all had. So to me, the renewal means reconnecting with the community and being able to work with kids and families in more naturalistic settings.
We are at time, but I would just like to say and give a really heartfelt thank you to all of the panelists today, Adugo, Jeff, and Pamela. Thank you for taking the time to share your expertise on all these topics. And I'd like to say thank you to the audience members as well. We really appreciate you tuning in and your lovely comments as well. Our next event will be held on May 21st at 1:30 p.m. Pacific time, where we will continue this discussion on youth mental health services and see the perspective of a student and a social worker as well. So we hope to see you there, and just take care.
Thanks so much.
Thank you.